for a change.
So let's talk about something very costly, single-payer healthcare. You've been very supportive over the course of the campaign.
Yeah.
You've expressed in the past support for Senate Bill 562, single-payer healthcare here in California.
As amended, yes.
Right. So it passed the state Senate. It died in Assembly. Do you, as governor, do you hope to revive that bill? Do you want to see a new bill? How do you plan to get single payer passed?
It needs to be pulled into the governor's office. The executive needs to lead it. Obamacare would not have happened. It was just exclusively a legislative fiat. That said, Nancy Pelosi did a magical job of organizing it, but it required the concerted contributions of the President of the United States. The only way in a state whose population is larger than 163 nations, California, whose economy is larger than all but 4 nations, the 5th largest economy, to approximate a strategy for universal health care is with the support and concurrence of the governor. And that's, frankly, it's not an indictment. It's just what's been missing in the past. So I would bring that into my office. I'd broaden it well beyond a bill that basically started a process. If you read 562, which the vast majority of elected officials that were for and against it did not. For and against, did not, because they would have actually known what it said. It created a committee that began a process to come up with a strategy and plan to finance and organize with 34 prescribed benefits a universal strategy for single-payer financing. That process can be done without a bill. That process should be done by the next governor, and I'm committed to it for no other reason than healthcare is devouring our budget. Healthcare in this state is the biggest driver of unfunded retirement benefits. It's a driver of a lot of our costs, not least of which at the UC and CSU. I serve on both those boards. Tuition is impacted by the costs of employment, personnel costs, which is impacted by healthcare. It's the issue that animates most of the voters I talk to still, even in this post-Obamacare world. And the inflationary burdens are self-evident, and the vandalism these guys are doing in the federal level is only going to make things worse. So I'd like to see if we can control our own destiny. I'm not naive about it. I did universal health care when I was mayor, fully implemented, regardless of pre-existing condition, ability to pay, and regardless of your immigration status. San Francisco is the only universal health care plan for all undocumented residents in America. I'm very proud of that. And we proved it can be done without bankrupting the city. I'd like to see that we can extend that to the rest of the state.